debate was the COVID-19 pandemic and the efforts to fight it with things like lockdowns and mandatory masking.
Now, with COVID cases once more on the rise across the nation, the CDC has put together a plan for possible universal masking recommendations again in certain areas. The question is, could this be the future for Tucson? Fox 11's Sean Mahoney took this question to local health leaders. And Sean, what would it take to see masking become prevalent again in the Old Pueblo?
Yeah, well, Dan, Mary, the CDC will recommend universal masking, and keyword recommend, if there are 20 hospitalizations per 100,000 people in a specific area. Now, going even further, mask mandates, well, those are no longer a thing of the past. Just this week, 2 companies in Los Angeles and a liberal arts school in Georgia implemented mask mandates, according to a CBS national report. And I know it's been a long time since we thought about this, but Tucson health officials say it will be a lot longer for us here before we see widespread mask recommendations.
The viruses mutate. We're going to get different variants. And because we get these different variants, it means that, COVID hasn't gone away.
A new variant and a new life into the fear of COVID throughout the nation. But Tucson health officials say not to fear.
So these viruses can't get quite the foothold that they could back in 2020.
As of last week in Pima County, there were 40 cases of COVID-19 per 100,000 people and around 10 hospitalizations per 100,000 people, both below the national average. However, officials say testing data is not the same as it once was.
Just given that we are seeing an uptick in cases, I would say it's much more widespread than those case numbers indicate.
Without free testing, Dr. Goodrum says data may be a little more inaccurate, but even the smaller sample size, it's still clear who is affected the most by these new variants.
However, it should be noted that those hospitalizations are almost exclusively in people 65 and older and predominantly unvaccinated individuals.
Now, if hospitalizations were to double, then the CDC would recommend universal masking for all Tucson residents once again. The question is, will it happen?
I doubt we'll get to the place where we would really need to recommend universal masking.
Pima County health officials say currently masking is based on personal assessment, something they also don't see changing.
In terms of masking, right now it's at an individual level.
Derby says the county is using extra caution to try and avoid extra responses from the public.
Because if we start telling everyone to mask now, we could get mask fatigue. And when we really need to mask, people might say, hey, I'm done.
Regardless, whether it's masking for COVID or not, doctors say it's still something to consider.
A mask is a great way to help prevent transmission. And there are a lot of viruses out there that are just as bad as COVID right now.
Yeah, well, whether you decide to wear one of these or not, Dr. Goodrum says we could continue to see slight increases in cases over the next few weeks with students now back at classes at the U of A. But projections say these new variants will not be as dangerous as previous versions of the virus. That's the good news. And even with viruses like RSV and influenza arguably posing a similar, if not greater, health risk to residents. Reporting at the Live Center, Sean Mahoney, 13 News.
Thank you, Sean. Immigration action and border security were some more of the hot topics.